Good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, with your COVID-19 update for Friday, May 22nd, I believe. Yep, yes it is. Friday, May 22nd. Nice, beautiful, sunny day. It looks like the first day of real summer weather is going to be joining us today, so that's good news for everybody. So I hope you can get outside and enjoy it a little bit. So let's take a look at this morning's numbers, and I apologize for some of the confusion yesterday, but I was able to get those numbers out to you after my initial broadcast. But for today, we've had a total of 103 cases since March 15th. Total recovered is 75. There were 16 positive cases as of this morning. That's up 2 from yesterday. Still pretty low overall. We've lost 10 during the follow-up phase of the contact, and then also we've had 700 people even test negative for the COVID-19 virus. A total of 4 people remain hospitalized. So we continue to keep an eye on those folks. Hope they continue to do well. At some point, they can get out of the hospital and get back to their normal way of life. And we've lost 1 person from death through the COVID-19 complications. All right, so on a statewide basis, particularly on a county basis right now, statewide basis, 90,084 cases have occurred in Massachusetts since the start of the virus. We've had 501,486 tested, so that number is ever increasing. The increase in the number of cases is not as significant. It is up a little bit, still below the 10% threshold number that we've been looking to see, which is good. In Norfolk County in particular, 7,691 cases have occurred, and a total of 759 deaths have occurred since the COVID-19 virus first impacted here in Massachusetts and in this county. On the Middlesex County level, 19,930 cases have occurred in Middlesex County. They lead the way in the state, continue to lead the way, and also with deaths, 1,478 people have died as a result of the COVID-19 virus. And the 19,930 is obviously Middlesex County is pushing up against 20,000, and hopefully that number will continue to slow down as it has been. Total number of hospital beds available is 17,200, and that number has dropped as well. So they're now down almost 1,000 beds since within the past week and a half. 2,323 people are currently hospitalized, and a total of 628 cases are in ICU. So those cases continue to drop, which is good to see that, and the trend is clearly in the right direction. Let's take a look at what the report says for today. The temporary shutdown or reduced operation of a building and reductions in normal water use can create hazards for returning occupants. These hazards can include mold and Legionella. After a prolonged shutdown, building owners and employers should ensure that their buildings do not have mold and that the water system is safe to use to minimize the risk of Legionnaire's disease. Guidance on how to do this is available from the CDC. So just with people going back to work, we certainly want to make sure that people are taking all the precautions to stay healthy, given those complications of not being in the building for quite some time. So many of the town facilities have remained open, so we don't anticipate that to be an issue at the town level, but certainly a number of private businesses may have been impacted by that. The Shine service serving health insurance needs for everyone remains available via telephone to provide necessary information regarding Medicare, Mass Health, and other insurance programs. The perpetrators of a recent scam in Massachusetts targeting older adults identify themselves as from the Shine organization, and they proceeded to request banking information to assist with the receipt of federal stimulus payments. Shine counselors are not calling older adults to discuss the stimulus payments and would never request banking information over the phone. Please report the receipt of these calls to the Executive Office of Elder Affairs at 617-222-7416. And those are people, again, representing themselves as Shine counselors, and if they ask you at all about any kind of banking information or any related to any of your stimulus checks Please make sure that you do not share that information with them, and certainly report that information to the Executive Office of Elder Affairs at 617-222-7416. COVID-19 Command Center will include in the DPH Daily Dashboard 6 key public health indicators and trend data. Before and during reopening, these metrics must continue to show progress. The Department of Public Health continues to make available on the underlying data for download. City and town case data are published weekly each Wednesday. 6 metrics are COVID-19 positive test rate, number of individuals who have died from COVID-19, number of patients with COVID-19 in hospitals, healthcare system readiness, testing capacity, and contact tracing capacity. And from the MRC email from May 21st, obviously being yesterday, there were 90,084 cases, as we mentioned earlier, of COVID-19 in the Commonwealth, with 1,114 new cases and 82 deaths as of yesterday at 4 p.m. The average new cases of deaths is 107. 9.7% of the 11,533 cases of the weighted cases of the positive cases have tested positive. The 23,000 individuals that are in the hospitals is actually down from 122 from yesterday. And let me see here. I'm seeing some impact. I'm going to try and do this one more time because it looks as though this report is not coming up well. So let me try this one more time. And okay, here we go. All right. So the 2,396 individuals who are hospitalized with COVID-19 statewide is a decrease from 122 from yesterday. The Department of Public Health regularly releases a daily reporting dashboard containing detailed information on hospitalizations, demographic data, and county-by-county breakdowns of cases. The Executive Office of Housing and Community Development has released a helpful one-page summary of what businesses can expect in Phase 1 of the reopening process. This summary includes a timeline for reopening by industry sector as well as the documentation required for opening. More information can also be found at mass.gov/reopening. If you need additional guidance or have questions, either as an employer or as a worker, you can submit questions and comments on the reopening use online and contact form via email. In healthcare and hospital capacity as of 5/21, 50% of the Commonwealth's 17,200 permanent temporary beds are available for new patients if needed. Personal protective equipment distributions across the Commonwealth include over 408,000 N95, K95 masks, and 136 ventilators. Global testing, the National Guard has continued to work with long-term care facilities and has made 733 visits and conducted 46,122 tests as of May 21st. And those wishing to access the statewide COVID-19 test locator map can visit mass.gov/COVID test map to find a provider close to them. I know CVS opened up several new locations as of today, so those will be listed on the map as well. And as a reminder, those who need health insurance coverage for June 1st must enroll through the Health Connector by Saturday, May 23rd. And yesterday, the special enrollment period for health insurance coverage was extended to June 23rd, allowing individuals to enroll in new health insurance plans without a qualifying life event. More information on Health Connector services during the COVID pandemic can be found at mahealthconnector.org/COVID-19. Now, on the small business front, additional Massachusetts-specific resources on the PPP can be found on Mass Growth Capital Corporation website. That's the MA Growth Capital Corporation website. And education, yesterday, the Department of Elementary and Secondary Education released detailed guidance for families, schools, and school districts on how to safely conduct graduation ceremonies. And on the legislative front, today the House of Representatives convened several groups to investigate different aspects of the new stages of COVID-19 crisis and recommended policy changes as needed to address these unprecedented challenges. Speaker DeLeo appointed Majority Leader Ron Mariano to lead the Commonwealth Resilience and Recovery Special Committee, which will evaluate all aspects of the Commonwealth's economic recovery from the pandemic. Education Chair Alice Peach has also appointed the head to Early Education and Care Recovery Advisory Group to address the child care needs created by the pandemic. And Tourism, Arts, Cultural, and Development Chair Paul McMurtry has convened an advisory group to make recommendations relative to the restaurant industry. Today, the Attorney General reached $1.4 million settlement with Education First, an educational travel company, to refund families whose trips were canceled due to COVID-19. Families who are seeking refunds for trips scheduled between March 11th and May 14th should call EF directly to get their refund for international trips. Families should call 1-800-665-5364. That's 1-800-665-5364 and 1-888-333-9756 for domestic trips. Now, on the local resource front, the Department of Public Health also releases weekly reports on town-by-town COVID-19 cases and rates. We get a lot of that. We provide a lot of information to you on a daily basis, and we get that information directly from the Board of Health here in Foxboro. So that information is up to date. On unemployment assistance, you can go to the mass.gov.org/Department of Unemployment Assistance and to get also additional information from the Pandemic Unemployment Assistance Program, the CARES Act, unemployment changes, unemployment town halls, and Department of Transitional Assistance and pandemic EBT programs are all listed on the mass.gov websites. And on the current statewide advisories, Safer at Home, as of May 18th, the statewide stay-at-home advisory is now the Safer at Home advisory. Excuse me. In many ways, this advisory remains in the same spirit as previous policies. You should practice social distancing and limit your non-essential interactions as much as possible. The face covering advisory remains in place, and reopening guidance. For more information on the state's phased reopening plans, in particular industry specific guidance, you can visit mass.gov/reopening. On the local front, just a reminder to everybody that we should be very mindful of the fact that we should really limit our outdoor watering at this point. There's been quite a bit of outdoor watering going on in Foxboro, and that is going against the DEP guidelines that that are issued for the town for limiting how much money we can draw out of the ground. As I indicated yesterday, there is no supply issues here in Foxboro, but there is a limit on how much we can take out of the ground by virtue of the state's guidelines on that. So through DEP. So we do strongly encourage people to not be watering unless you're absolutely necessary to do so, and please be advised that we also had a major water break just the other day, 2 days ago, which impacted the storage capacity of one of our major tanks, and as a result that we lost nearly 1 million gallons of water. So so that is impacting our water distribution services to a degree, but certainly that's only because the significant impact was caused by the loss of water through that major water break. So we strongly encourage people to not use as much water during the next few days. It is supposed to rain tomorrow, so anybody who's worried about any kind of concerns over their gardens or grass, that will be addressed by tomorrow's rain. We should be able to get a fairly significant amount of rain that will certainly help that situation. So we want to be mindful of that. And on the reopening plans, we will be announcing the town's reopening plans on Tuesday night next week at the Selectmen's meetings, and giving you an indication as to where things are with the town across the various town agencies. We've had some indication, some good information that some of the limited summer camp will still be held in Foxboro this upcoming few months. We're working on there's a limited program. There'll be about 75 people 75 kids that will be allowed to attend, using obviously very strict and formal social distancing guidelines, making sure that everybody stays safe during that effort. And also, as far as some of the local businesses go, we're actively looking into possibilities of doing outdoor dining, so that we can actually help some of the local businesses and restaurants. A number of communities throughout the Commonwealth have been looking at that as an option to allow for safe dining, so restaurants can get open again, and we can provide some outdoor dining opportunities for folks. There are some limitations as to how that can be allowed, either by sidewalks or for zoning issues and licensing requirements. So we're going to try and work through that process. I know that Senator Feeney had actually filed a bill in the Senate to try and ease the restrictions in terms of allowing restaurants to serve to do outside service, and not have to require they go through the state ABCC process. It would still be regulated locally, but it would not require the state process, due to the fact that they would really slow that process down and probably not make it available for the summer use. So that bill is making its way through the Senate and the House, and expected to make it to the governor's desk fairly shortly. Obviously, because the need for having that done now is really important. So that is the latest information we have. Again, try and limit the use of water. That's really important for us in the town right now, in the outdoor watering piece. Again, not a problem with supply again, but it is a limitation in terms of our drawing down on based upon our permit requirements, and so we really want to make sure that we stay within those guidelines as issued by the state DEP. So that's it. That wraps up things for here, and we will be back with you. I'll be back with you tomorrow morning with another update on what's been happening locally. Numbers are looking pretty good as of right now. They are down, but they still continue to go up, but they are down in terms of the rate of going up. So that's really important to see that, and we'll continue to provide more information as it is made available to us on lots of different fronts here in Foxboro. Until then, I'll see you next time. I'll see you tomorrow morning at around 10:30, and we'll be happy to update you with further information about what's happening in and around Foxboro. Until then, take care.